If you're experiencing orgasms with little to no semen, you need to hear this right now. Hello, gentlemen. I'm Dr. Jocelyn, a urologist with over a decade of experience helping men understand and address complex sexual health issues. Today, we're discussing dry ejaculation, also known as retrograde ejaculation, a condition where you reach orgasm but produce little or no semen. And if this is happening to you, you're probably confused, worried, and searching for answers. Here's what you need to know immediately. Dry ejaculation affects approximately 1 in 100 men, but up to 75% of men who've had certain prostate surgeries experience this condition. It's not painful, it doesn't affect your ability to have erections or orgasms, but it can cause infertility and significant emotional distress. The good news, in many cases, it's treatable. And even when it's not reversible, there are solutions that can help you achieve your goals, whether that's fertility or simply understanding what's happening to your body. Before we dive in, hit that like button right now. Comment below where you're watching from and subscribe so you never miss critical health information for men over 50. Now let me explain exactly what's happening and what you can do about it. Let me start by explaining what's actually happening inside your body. Normally, when you orgasm, semen travels through your urethra and exits through your penis. Your body produces 1/2 to 1 teaspoon of semen during orgasm, though this amount varies widely between men. In dry ejaculation, also called retrograde ejaculation, the semen doesn't exit your penis. Instead, it flows backward into your bladder. This happens because the muscle at the base of your bladder, called the bladder neck sphincter, doesn't close properly during ejaculation. Think of this muscle as a valve. Normally, it contracts tightly before ejaculation, preventing semen from entering your bladder and forcing it to exit through your urethra, the path of least resistance. When this valve doesn't work correctly, semen takes the easier path backward into your bladder instead of forward out of your penis. The retrograde ejaculated semen then mixes with your urine and exits your body the next time you urinate. That's why many men with this condition notice cloudy urine after orgasm. Here's what's important to understand. Retrograde ejaculation doesn't affect your ability to get an erection. It doesn't affect your ability to reach orgasm. It doesn't cause pain. What it does affect is fertility, because sperm can't reach your partner's uterus if it's going into your bladder instead. One patient, 54 years old, came to me terrified. He'd been experiencing dry orgasms for 2 months and thought something was seriously wrong. After explaining retrograde ejaculation and running tests, we determined it was caused by his blood pressure medication. Simply switching medications resolved the issue completely within weeks. Understanding what's happening is the first step toward finding a solution. If this is the first time you're hearing about retrograde ejaculation, drop a comment and let me know. Let me walk you through the most common causes because understanding why this happens is critical to finding the right treatment. Cause number 1, medications. This is the most common reversible cause. Several types of medications can cause retrograde ejaculation by relaxing the bladder neck muscle. Alpha blockers used to treat enlarged prostate or high blood pressure, including tamsulosin, alfuzosin, and silodosin, are major culprits. Silodosin is particularly likely to cause this because of its high selectivity for certain receptors. Antidepressants, especially selective serotonin reuptake inhibitors like fluoxetine and sertraline, can also cause dry ejaculation. Antipsychotic medications, including chlorpromazine, thioridazine, and risperidone, are also associated with this condition. Cause number 2, prostate surgery. This is the most common permanent cause. Transurethral resection of the prostate, or TURP, causes retrograde ejaculation in up to 75% of men who undergo the procedure. Other prostate surgeries, including simple prostatectomy and certain laser procedures, can also cause this. Surgery physically changes the anatomy of your bladder neck. When surgeons remove prostate tissue to relieve urinary obstruction, they often affect the muscles that normally keep the bladder neck closed during ejaculation. Cause number 3, nerve damage from medical conditions. Diabetes is a major cause, especially in men with long-term, poorly controlled blood sugar. High blood sugar damages nerves throughout your body, including the nerves that control your bladder neck muscle. Multiple sclerosis, Parkinson's disease, and spinal cord injuries can also damage these nerves. Spinal cord injury patients experience retrograde ejaculation at rates between 8 and 37%, depending on the level and severity of injury. Cause number 4, radiation treatment. Men who've had radiation therapy for prostate cancer or other pelvic cancers may develop retrograde ejaculation due to damage to the bladder neck or surrounding nerves. Cause number 5, diabetes complications. Beyond general nerve damage, diabetes can specifically affect the nerves controlling ejaculation. This is especially common in men who've had diabetes for many years without good control. One patient had developed retrograde ejaculation after starting tamsulosin for his enlarged prostate. He didn't realize the connection until we reviewed his medications. After switching to a different treatment for his prostate symptoms, his normal ejaculation returned within 3 weeks. Understanding the cause determines what treatment options are available. Comment below, do any of these causes apply to you? Let me describe the specific symptoms so you know what to watch for. Symptom number 1, little to no semen during orgasm. This is the hallmark sign. You experience orgasm, you feel the sensation of climax, but little or no fluid comes out. This happens in nearly 100% of cases. Some men produce a small amount of semen, but the volume is dramatically reduced, often by 80 to 90%. Symptom number 2, cloudy urine after orgasm. This occurs in 70 to 80% of men with retrograde ejaculation. Because semen enters your bladder during orgasm, your first urination afterward will have a cloudy or milky appearance. This is one of the clearest diagnostic signs. Symptom number 3, infertility. If you're trying to conceive and your partner isn't getting pregnant despite regular unprotected intercourse, retrograde ejaculation could be the cause. This condition is responsible for about 1% of all male infertility cases in the United States, but accounts for 50 to 60% of infertility in men with retrograde ejaculation. Symptom number 4, difficulty achieving orgasm. About 30 to 40% of men with retrograde ejaculation report this. The psychological impact of not seeing semen can affect your ability to climax fully. Symptom number 5, reduced sexual satisfaction. About 20 to 30% of men report decreased sexual satisfaction. Even though the physical sensation of orgasm remains, the visual and psychological absence of ejaculation can reduce overall satisfaction. It's critical to understand that retrograde ejaculation does not cause erectile dysfunction, does not cause pain, does not reduce sensitivity, and does not affect your ability to reach orgasm. The orgasm itself feels normal. It's only the absence of visible semen that's different. One patient told me, I can climax just fine. Everything feels the same, but nothing comes out. It's psychologically disturbing. Even though physically everything works, that psychological impact is real and valid. Even though the condition itself is physically harmless, let me explain how we confirm this diagnosis. The diagnosis is usually straightforward. Your doctor will start with a detailed medical history asking about your symptoms, when they started, what medications you're taking, any surgeries you've had, and any medical conditions you have like diabetes or neurological disorders. Next comes a physical examination. Your doctor will examine your genitals to ensure there are no anatomical problems and check for any signs of surgical scars or other issues. The definitive diagnostic test is a post-orgasm urinalysis. Here's how it works. You'll be asked to empty your bladder completely, then masturbate to orgasm and immediately provide a urine sample. That sample goes to the laboratory for analysis. If a high volume of sperm is found in your urine, you have retrograde ejaculation. The presence of semen in your bladder after orgasm confirms the diagnosis definitively. If your doctor doesn't find semen in your bladder, but you're still having dry orgasms, that indicates a different problem. You might have damage to your prostate or seminal vesicles from surgery or radiation that's preventing semen production entirely. That's called anejaculation, which is different from retrograde ejaculation and requires different evaluation. One patient was convinced he had retrograde ejaculation, but the urinalysis showed no sperm in his urine. Further testing revealed he'd had radiation damage to his seminal vesicles from previous cancer treatment, which was preventing semen production altogether. The distinction matters because the treatments are completely different. Proper diagnosis guides proper treatment. Now, let me walk you through your treatment options, because what works depends entirely on the cause. Option 1, medication adjustment. If your retrograde ejaculation is caused by medications, this is often the easiest solution. Your doctor can switch you to a different medication that doesn't affect ejaculation. For example, if you're taking an alpha blocker for prostate symptoms, switching to a different type of prostate medication might resolve the issue. If you're on an antidepressant, changing to a different class of antidepressant could help. Option 2, medications to treat retrograde ejaculation. If nerve damage is causing your condition, certain medications can help tighten the bladder neck muscle. Imipramine, a tricyclic antidepressant, can help close the bladder neck during ejaculation. Pseudoephedrine and ephedrine, commonly used as decongestants, can also tighten the bladder neck. Midodrine, typically used for low blood pressure, may help improve semen transport. These medications work best when retrograde ejaculation is caused by mild nerve damage from conditions like diabetes, multiple sclerosis, or mild spinal cord injury. They don't work if you've had surgery that permanently changed your anatomy. Important warning: these medications can raise blood pressure and heart rate. If you have heart disease or uncontrolled high blood pressure, they may not be safe for you. Your doctor will monitor you closely. Option 3, assisted reproductive technology. If you want to father a child and medications don't work, fertility specialists can help. Sperm can be recovered from your bladder after ejaculation, processed in a laboratory to separate healthy sperm, and used to inseminate your partner through intrauterine insemination. In more complex cases, techniques like in vitro fertilization may be necessary. Many men with retrograde ejaculation successfully father children using these techniques. Option 4, acceptance and reassurance. For many men, especially those who aren't trying to conceive, no treatment is necessary. Once you understand that retrograde ejaculation is harmless and doesn't affect your sexual function, many men are comfortable simply accepting it. One patient, 62 years old, had developed retrograde ejaculation after prostate surgery. He wasn't concerned about fertility, but the dry orgasms bothered him psychologically. After several counseling sessions where we discussed the normality of his sexual function despite the absence of semen, he became comfortable with his new normal. He told me, "Once I stopped focusing on what wasn't there and started appreciating that everything still works, my sex life actually improved." Treatment depends on your goals and the underlying cause. Let me give you practical strategies you can implement yourself. First, pelvic floor exercises. While not proven specifically for retrograde ejaculation, strengthening your pelvic floor muscles through Kegel exercises may help improve bladder control and ejaculation control. To do Kegels, contract the muscles you use to stop urinating midstream. Hold for 3 to 5 seconds, then relax. Repeat 10 to 15 times, 3 times daily. Consistent practice over weeks to months can strengthen these muscles. Second, manage underlying conditions aggressively. If diabetes is contributing to nerve damage, controlling your blood sugar is critical. Aim for hemoglobin A1C below 7%. Check your blood sugar regularly, take medications as prescribed, and follow a diabetes-friendly diet. If multiple sclerosis or another neurological condition is involved, work closely with your neurologist to manage the condition as effectively as possible. Third, track your medications. Keep a detailed list of all medications you're taking, including over-the-counter drugs and supplements. If you start a new medication and notice dry orgasms developing, report this to your doctor immediately. The sooner you make the connection, the sooner you can adjust treatment. Fourth, communicate with your partner. If you're in a relationship, talk openly about what's happening. Many partners are understanding once they know retrograde ejaculation doesn't affect your attraction to them or your ability to enjoy intimacy together. One couple I worked with had been struggling because the husband was embarrassed about his dry orgasms and stopped initiating sex. Once they discussed it openly and she understood it was a physical issue unrelated to his desire for her, their intimate life improved dramatically. Fifth, seek mental health support if needed. The psychological impact of dry ejaculation can be significant. If you're experiencing anxiety, depression, or relationship stress related to this condition, talking with a therapist who specializes in sexual health can be incredibly beneficial. You're not alone in dealing with this, and support is available. There are specific situations where you should seek medical attention right away. First, if dry orgasms start suddenly, if you've always had normal ejaculation and suddenly start experiencing dry orgasms, see a doctor promptly. This could indicate a new medical problem that needs evaluation. Second, if you notice blood in your urine. While retrograde ejaculation can cause cloudy urine, it should never cause blood. Blood in your urine requires immediate medical evaluation. Third, if you experience pain during or after orgasm, retrograde ejaculation shouldn't hurt. Pain suggests a different problem, possibly prostatitis, urinary tract infection, or another condition. Fourth, if you're trying to conceive without success, if you've been having regular, unprotected intercourse for a year or longer without pregnancy, see a fertility specialist. Retrograde ejaculation might be preventing conception, but treatment can help. Fifth, if dry ejaculation is causing significant psychological distress, if this condition is affecting your mental health, relationships, or quality of life, don't suffer in silence. Medical and psychological support can help. Don't ignore symptoms or hope they'll resolve on their own. Early evaluation leads to better outcomes. Gentlemen, here's what you need to understand. Dry ejaculation, or retrograde ejaculation, is a condition where semen flows backward into your bladder instead of out through your penis during orgasm. It affects about 0.3 to 2% of men overall, but is much more common after prostate surgery or in men taking certain medications. This condition doesn't affect your ability to get erections, doesn't cause pain, and doesn't prevent orgasm. What it does affect is fertility, and for many men, psychological well-being. The causes include medications, prostate surgery, nerve damage from diabetes or other conditions, radiation treatment, and spinal cord injuries. The main symptoms are little to no semen during orgasm and cloudy urine after sex. Treatment depends on the cause. Medication adjustments can resolve drug-induced cases. Specific medications can help nerve damage cases. Assisted reproductive technology can help men who want to father children. And for many men, simple reassurance and acceptance is all that's needed. If you're experiencing dry orgasms, see your doctor for proper diagnosis. Don't assume it's retrograde ejaculation without confirmation, and don't assume there's nothing that can be done. Many cases are treatable, and even permanent cases have solutions. If this video helped you, hit that like button right now. Comment below and tell me, were you aware of retrograde ejaculation before watching this? Do you have questions? And subscribe for more honest, comprehensive health information for men. I'm Dr. Jocelyn, your sexual health matters, and you deserve clear, accurate information to make informed decisions. Take care of yourself and don't hesitate to seek help when you need it.